Okay, this is the Pain Away laser by Multi Radiance, and we rent these out, and we rent them by the day or by the week, and we also sell them. If you wanted to buy a brand new one, we sell these as well. And sometimes we have used ones for sale as well. Now, with this laser, we'll show you what all these buttons mean. There's only 2 buttons on here, so it's really easy to use. But first of all, it comes in this case. Never leave it out of this case unless you're using it. When you're done using it, you put it back in the case, especially if you have children or an animal, a pet around the house. These are expensive. So if you rent it and you damage it, you're responsible. So just to be aware of that. They can fix them, but and they're not expensive to fix. God forbid you do drop it or something like that. But it's really lightweight, really small, easy to handle, as you can see. And we'll go into the buttons in a second here. It comes with a charger, a lithium-ion battery. So the lithium-ion battery is good for a week to 2 weeks even of treating, like 2 to 3 times a day. So it'll last a long time. And then we have 2 pairs of glasses. If someone's helping you, treating your back or something, make sure they're wearing these glasses. If you're treating an area that's in your visual sight, you want to make sure you're wearing the glasses, or anybody that's in the room. Nobody should be looking at this light. It's very safe, but there are some contraindications to using cold laser therapy or this particular laser. So let's get into that, okay? So one of the things, one of the contraindications for this cold laser is somebody with a pacemaker. If someone has a pacemaker or a defibrillator, you want to stay away from, especially that pacemaker, about a foot away from the pacemaker. So the left AC joint or shoulder, you probably would not want to treat that patient that has a pacemaker. If it's their knee, left or right knee, it's going to be fine. No problems there. So if you have any questions, you can certainly ask. We give you a 3-fold brochure, where to put the laser, what programs to use. So let's dive right into it. So here's the laser, and you'll see it has 2 buttons, the white one and the red one. Now the white one is the power button. The red one switches through modes. The first time you turn it on, it needs to test the laser. So watch this. So we're going to turn it on. You'll see all the lights come on. Okay? So now what it wants to do is it wants to test the laser. So you want to put it against your skin or really anywhere on your body and hit the start button again, and it's going to go ahead and you'll see it test. Tested 1, 2, and now it's going to test 3. There we go. Everything cleared up. It wants to make sure that it's working properly. So now it's ready. So now you press the red button to flip through the different modes. Now as far as the different modes go, each mode has uses different frequencies and different wavelengths, and this particular laser uses a sweep of wavelengths, so it uses a range of wavelengths. So for example, program 1 is for an acute injury. If you just twisted your ankle and you have this laser within the 48 hours of that injury, you would use program 1. Most people, I find though, you know, we may do that in the office, but by the time they get in to get a laser treatment, or usually it's been weeks, sometimes even months or years. And in that case, you would start with program 3, you see here. Okay, and program 3 uses certain wavelengths that are more conducive for pain management. And then program 2, you see right in the middle, that's used more for soft tissue, healing and repairing. And the laser I have in the office has a much wider range and can start to heal and repair soft tissue. This laser is so effective for spasms, pain, inhibiting nerves. So if you have occipital neuralgia or a headache or facial neuralgia or trigeminal neuralgia or sciatica, this will help immensely. And then to shut it off, so you would turn it on, and again, it'll work for about 5 minutes and it'll shut off automatically. And then you just make sure that it's on the right program that you want, program 3. Usually I start patients out on program 3 for the first few sessions, and then I have them switch to program 2 after the pain is reduced significantly. But you see here it's turned on. I don't have my glasses on here, but You can see here that we have it turned on. We're going to shut it off, and then to really shut it off, we're going to just hold that button down just like that, and about 3 seconds, 3 to 4 seconds, and it shuts off. Now you'll notice when I turn this laser back on, it could be 30 minutes later, 10 minutes, 5 minutes, maybe I treated my knee. And again, this is set on a timer of about 5 minutes, so it'll shut off automatically after that. But if you turn it back on again, it's not going to ask you to test all the lasers. So watch. So now it turns right back on, and then you can go ahead and put it right into the mode right away. Again, that's if you've used the laser before that day, and that'll last for a few hours. A few hours go by, when you do your next treatment, it probably will ask you to test each laser again, and all 3 will light up. So again, shutting it off, you just hold it down for 3 seconds and it shuts off. Want to make sure that you store it in this container when you're not using it at all times. This will keep it safe. It's got foam in it. Again, we rent them by the day or by the week. If you have any questions as to whether or not this could be used for a condition that you have, you're free to call us. But what's beautiful about this is you can use this from the comfort of your own home. And I'm going to show you a little bit about the guides that it comes with. It comes with an operating manual, and it comes with a therapy program. So it tells you the frequencies it uses and what it's meant to do. Like program 3 and 2, I said, are inhibitory. Program 1 is for an acute injury. And if you want to get more down to soft tissue, ligament, and tendon and muscle, that's going to be program 2. So program 3 focuses on pain. You do that for the first few treatments. Then you switch to program 2 after the pain is reduced significantly, at least 75%. Then program 2, and that's pretty much it. And this comes with it, a clear explanation of all the different frequencies and different programs. It's much simpler than this card looks. It's simply program 3, 2, 1, and we write that all down for you. So there's no guesswork. If you have any questions, feel free to comment on the video below, and I hope this helps, and feel free to email us also.